Hello, my name is Kyle Longton, and I'm the Chief Executive Officer and Executive Vice President of the American Foreign Service Protective Association, or AFSPA. Now, you may know AFSPA as the sponsor of the Foreign Service Benefit Plan, one of the health plans available through the Federal Employee Health Benefits Program. And while that's true, my colleagues and I also are proud to be subject matter experts in the FEHB program. And for the purposes of this video, how Medicare works with the FEHB program. So the information in this video is general to how Medicare and the FEHB program work together, not specific to the Foreign Service Benefit Plan. We'll address specifics on various plans throughout the video and how you can find out more. But this is general and it is meant only for federal employees and annuitants, as well as their dependents who are covered by the FEHB plans. So please keep that in mind as you view this video. If you've watched previous videos, and we've had some up previously, please know that this has been updated and the information is current as of March 2024. So we'll try to make sure that we update this again in a year or even later this year if there are more updates to be had. I will be sharing video and slides throughout this. I encourage you to watch this many times, pause, make use of the resources that are linked throughout the video, and you'll see my contact information at the very end. Please don't hesitate to reach out to me if you have specific questions that a colleague or I may be able to answer or walk through your individual situation with you. So we do have slides to follow along with. I hope that the visual will be helpful to everyone as we go through 2024 Medicare and the FEHB and putting it together. Now, I want to repeat some of the caveats you just heard from me. There are a lot of regulations for the FEHB program as well as for Medicare. So I do want to encourage everyone watching this, review your FEHB brochure for whatever plan you are enrolled in, and make sure you review Medicare information material. And we'll talk about where you can locate some of that and some of the most relevant material to look at throughout today's program. I also want to note once again that the information in this presentation applies only to federal employees and annuitants. This is not applicable to individuals without FEHB. So sharing this presentation with a neighbor or a friend or a family member who does not have coverage under the federal program may not be terribly useful for them. It is not applicable to the private sector or commercial insurance. Now, throughout today, I will use various acronyms, and here's some of the most frequent. FEHB, I've already used. That is the Federal Employee Health Benefits Program. FFS is fee for service, type of plan that's offered under the Federal Employee Health Benefits Program. HMO stands for Health Maintenance Organization, a different type of coverage offered under the FEHB. OOP will come up a few times. This is out of pocket, money that you are paying out of pocket. And also OPM. This is the Office of Personnel Management, which oversees the FEHB program. Now, for many people who are watching this, the biggest question is, should I enroll in Part B? And we're going to spend a lot of time throughout the slides and the discussion answering this question, but it may be a shorter viewing for some than others because some of you may be considering spending time outside the U.S. once you become Medicare eligible. So I want to start with this because, again, it may end the video for some of you very early on. Medicare does not cover care you receive outside the United States except in certain very limited situations. And I mean, these are incredibly limited. So generally, your FEHB plan, your fee-for-service plan, is going to be primary for services that you receive outside the 50 United States. Typically, you'll have to pay for the service and then file a claim with your plan, even if you have Medicare A and or B for those services you receive outside the United States. So one question to ask yourself, a starting place is, are you going to spend a lot of time overseas? Are you going to receive a lot of your medical care overseas? So if you're going to settle outside the United States, live there, then Medicare Part B may not be right for you. If you're going to spend half your year outside the U.S., but you anticipate getting a lot of your medical care there, again, Medicare Part B may not be for you. All right, if you're still with me, and want to learn more, then here's a quick overview of what we're going to talk about today. First, I'm going to take you through each of the four parts of Medicare, which are labeled using letters A, B, C, and D. We'll talk about the premium costs for each, the out-of-pocket costs associated with each type of coverage, and very importantly, the different provider types within Medicare. And we'll have some charts and some examples on that to highlight the differences. I'm also going to spend some time talking about how Medicare coverage and FEHB coverage work together and what your costs are. And then we'll also address the question of if you don't have Medicare, but you retain your FEHB coverage, what does that look like for you? So hang in there with me throughout. And then again, as I said, there is an opportunity for you to submit questions directly to me. All right, so Medicare has four parts. Part A is part of what's known as Original Medicare. It is essentially hospital insurance. And for most people, this is free. Most people have paid into Medicare throughout their working lives, and so there is not a premium for Medicare Part A for most people. Part B is the other part of Original Medicare. This is typically medical insurance, and I'll give you some examples in just a moment, but this does have a monthly premium. And the standard premium is $174.70 per person per month. There's no family coverage or group coverage with Medicare. These are each individual coverages. And that is the standard monthly premium before the modified adjusted gross income means testing. And that is for 2024. It typically changes a little bit each year. We'll look at the full chart of the premiums a little bit later. Now, Part C is perhaps more commonly known as Medicare Advantage. And this is usually somewhat more comprehensive coverage. It takes coverage that you would have under A and B, and you have to be enrolled in A and B to select a Medicare Advantage plan, and combines it. So you do have to pay the Part B premiums. Often there is an additional premium, but often there are also some additional programs that come along with that. And I'll show some examples a bit later. Finally, Part D is the newest part of Medicare, established only in 2006. And this is prescription drug coverage. And the premiums for this vary depending on what type of plan you have. Let's dig in a little bit deeper on each of these. So Medicare Part A is essentially hospital coverage. It includes inpatient hospital care, but not observation care. And I mention that because many times now when someone goes to the hospital, particularly in an emergency situation, you may be there for up to 48 hours. You may be in a room. You may be seeing multiple doctors, including specialists, and receiving meals and even therapy visits. But you're not technically there inpatient. You are there under observation care. And Part A does not cover observation care. That's covered under Part B. Part A also covers hospice care services and provides limited care in inpatient settings for skilled nursing facilities. Now, that is when you are receiving skilled nursing care, not when someone's in a skilled nursing facility or an assisted living community where they're receiving custodial care or long-term care, even intermediate care. This is only for skilled care and it is limited. Now, I want to recommend that everyone who is eligible for premium-free Part A to enroll in Part A. Even if you're spending time outside the United States for the most part, you're back in the U.S. receiving care, Part A will help you. You should consider enrolling at your first opportunity at age 65, whether you're continuing to work or retiring around that age. Medicare Part B provides the medical coverage that we think of as everything else besides inpatient care. It's your doctor's services and tests. It's outpatient hospital services, including that observation care I mentioned. There is coverage for limited home health services when a patient is certified as homebound. It also provides coverage for things like durable medical equipment, kidney dialysis, and certain preventive screenings and other preventive services, but not an annual physical exam. That is something that is actually not covered under Medicare. Now, at age 65, enrollment in Part B is voluntary, so you do have an option whether to enroll or not. As I shared before, you must pay a monthly premium. And if you do not enroll at your first opportunity, you may end up paying a penalty if you decide to enroll at a later date. But there are certain situations where you can defer enrollment in Part B, such as if you are employed and covered under a group health plan that is based on current employment. So it could be that you're continuing to work past age 65 and receiving your benefits from that, or it could be that you have coverage under your spouse's health plan and your spouse is continuing to work past your 65th birthday and you've got coverage as a result of your spouse's active employment. So we'll talk a little bit about how that deferral can work and what's necessary to avoid penalties in those situations. I mentioned before that Part B is means tested based on your modified adjusted gross income. You may pay what's known as an income-related monthly adjustment amount, or IRMA. So what does that mean? Well, on this chart, it's laid out what it looks like for 2024 premiums. Basically, what happens is Social Security Administration goes back and looks at your tax filing from 2 years prior. So for 2024, they're looking at your 2022 taxes. And based on your income in 2022, that is how they establish what your monthly premium for Part B would be. So anyone filing individually in 2022 making $103,000 or less, or if you filed jointly in 2022 and the combined income was $206,000 or less, you are paying the standard monthly premium of $174.70. After that, you can see from the chart that it goes up in increments. And for those in the highest tier of income, the monthly premium is $594 per month. And please keep in mind these monthly premiums are per person. So if you are married, there's 2 of you who are eligible for Medicare. Each of you would be responsible for paying this amount for Part B each month. There's more information in the Medicare publication, Medicare Premiums, Rules for Higher Income Beneficiaries. And you can see the link, the URL, I should say, for that publication at the bottom of this screen. But I do encourage you to think about this. These amounts are adjusted each year based on Medicare's experience from the year prior. And they do sometimes also adjust the income brackets. So I encourage you around October and certainly by November of each year, this information is updated. And I encourage you to take a look at it to know what the year ahead looks like for you. Now, it can happen that when you retire and you then become eligible for Medicare Part B, or perhaps you've retired prior to age 65, but were working 2 years earlier, you may have a higher income reported on those tax returns from 2 years prior than you're actually bringing in at the time you apply for Medicare Part B. Now, there is a process for premium redetermination. And it's laid out in that same publication I mentioned, Medicare Premiums, Rules for Higher Income Beneficiaries. And they list allowable reasons for requesting a new determination from the Social Security Administration, essentially qualifying life events. And these include situations such as you get married, you get divorced or are widowed, or if you or your spouse stopped working or reduced work hours. There may also be situations where more recent tax information is available. And you can contact the Social Security Administration for more information on appealing and looking for a redetermination of your monthly premium amount. You would call 1-800-772-1213 to contact Social Security, or I will have more information later on other ways that you can contact your Social Security office. All right, I want to move on to Medicare Part C. And as I mentioned before, these are typically known as Medicare Advantage plans. This is essentially a comprehensive type of option that has been reviewed and approved by Medicare. These Medicare Advantage plans may include additional benefits, things like vision coverage, dental coverage, additional podiatry benefits, and may also include lower cost sharing, so lower out-of-pocket costs when you see a provider than you might encounter with just original Medicare. You receive the same coverage, you receive coverage like you would under Part A and Part B, but not from original Medicare. You may have different out-of-pocket costs, and there may be other rules that apply. For instance, there may be situations where a pre-certification or prior approval does not apply under original Medicare, but it does apply under a Medicare Advantage plan. So it's important to understand what those rules are, what those requirements are if you're in a Medicare Advantage plan. It could also be that a Medicare Advantage plan, a Part C plan, requires that you only go to a certain network of providers to receive coverage, which may be a more narrow network than you have under original Medicare. Please note also that FEHB plans will not waive deductibles, coinsurance, and other cost sharing for care outside of a Medicare Advantage service area. Many Medicare Advantage plans may only provide coverage in a specific region, functioning more like an HMO. And if you get care outside of that and you have a commercial Medicare Advantage plan, that still remains the primary coverage even outside the service area. And your FEHB plan will not waive its the cost share that they might otherwise with original Medicare. I do also want to note that if you decide to enroll in a commercial Medicare Advantage plan, so a Medicare Advantage plan outside of the FEHB program, you do have the option of suspending your FEHB coverage. Don't cancel it or terminate, but you can suspend it. That allows you to come back during a future qualifying life event. But you can do that so you're not having both the Medicare Advantage commercial plan and the FEHB. You could just have that commercial Medicare Advantage plan if you so desire. And finally, Medicare Part D is prescription drug coverage through Medicare. The costs for these plans will vary, the premium amounts, and most people will pay a premium if they enroll in a commercial Medicare D plan. There will be a monthly premium, and with Medicare Part D, the means testing with your modified adjusted gross income applies also to the Part D premium. There are deductibles, copays, and coinsurance under these plans. So it's worth making sure you understand what you're enrolling in. It's also worth noting that every FEHB plan offers what's known as creditable coverage, which means that the prescription drug coverage under your FEHB plan is equal to, or in many cases better than, what you might find under a commercial Medicare Part D plan. And per the Office of Personnel Management, per OPM, federal retirees likely will not benefit from enrolling in a Medicare Part D and paying extra for prescription drug benefits when they have coverage under their FEHB plan. So I want to talk a little bit about signing up for Medicare at age 65, because it doesn't happen automatically. You do have to take action, but it also doesn't take very long. So everyone becomes eligible for Medicare during their initial enrollment period, which is the 7 months around their 65th birthday. So it's 3 months prior to your birth month, and then 3 months after your birth month. Everyone eligible for premium-free Part A should enroll at age 65. If for some reason you miss this initial enrollment period, there is a general enrollment period that occurs annually between January and March when you can enroll in Medicare. Do please take note that should you miss your initial opportunity to enroll for Part B, you may face a late penalty, which will apply to your premiums for as long as you have Medicare. And that penalty is 10% for each full 12-month period that you could have signed up for Part B and didn't sign up for it. So if you wait 3 years, you could be facing up to a 30% penalty on your premiums for the rest of the time you remain enrolled in Medicare Part B. So it's important to not miss that initial enrollment period. Now, I mentioned before there are some exceptions to that penalty. There are some situations where you can take advantage of what's known as a special enrollment period. And this is an 8-month period after employment ends, or your coverage under a current employment group health plan ends. So once again, you retire perhaps after age 65, or if you're covered under a spouse's plan at your 65th birthday and your spouse is actively employed, once that spouse stops receiving their health benefits as a result of active employment, you then have the opportunity to take advantage of this 8-month special enrollment period. Please note that, though, that retiree health plans do not count as current employment group health plans. Yes, it's still your FEHB plan. The benefits are the same, but it matters how you're receiving those benefits, whether it's the result of current employment or result of retirement benefits. It's also worth noting that you do have to prove that you were receiving benefits as a result of current employment after your 65th birthday. So there are a couple forms that you would submit when applying. There is the CMS 40B application. This is just your application to enroll in Medicare. But the important one is the CMS L564, and this is a proof of current employment coverage. This does have a portion that has to be completed by the employing office. And I really recommend that you start early on this one. Have your HR office complete this shortly before your retirement date. Please don't wait until the day you're retiring or even after to ask them to complete it. As you start thinking about it and set that date, go ahead and ask them to complete it. You will need to submit that to take advantage of the special enrollment period and avoid penalties. Also, please notify your FEHB plan when you enroll in Part A and if you enroll in Part B. Oftentimes, there are other ways that FEHB plans get that information and start to coordinate benefits, but just in case they don't, please go ahead and let them know when that happens. Provide them with your Medicare number once you have it, and they can start to ensure that you take full advantage of both your Medicare coverage and your FEHB coverage to avoid higher out-of-pocket costs. There are a number of ways that you can sign up for Medicare. At age 65, you can go online to the Social Security Administration's website, ssa.gov/benefits/Medicare. You can call at 1-800-772-1213. You can visit your local Social Security office in person, though I do recommend calling or checking their website beforehand to see if they're accepting walk-in appointments or if you need to make an appointment. Or if you're outside the U.S., you can enroll at your nearest U.S. Social Security office, which is usually inside a U.S. embassy or consulate. There is a URL on this current slide that tells you more about how you can sign up. It will also walk you through the sign-up process. I have helped family members with this. It takes very little time to do so, about 20 minutes. You establish your account with Medicare, and you go through and let them know exactly whether you want A or B or both, and it'll take you from there. But it is a fairly straightforward process. All right, I want to move on to talk about out-of-pocket costs for the various parts of Medicare. For Medicare Part A, and this is once again your hospital coverage, and these out-of-pocket costs are specific and updated for 2024. So the hospital deductible is $1,632 for inpatient days 1 through 60 of each benefit period. There is an additional $408 daily copay for inpatient days 61 through 90. Now, after that, there is an additional $816 daily copay for days over 90. And this is when you would be moving into your lifetime reserve if you're inpatient for more than 90 days. I also want to call out again skilled nursing facilities. After the first 20 days, there is a $204 daily copay for days 21 through 100. And this is only when an individual is receiving skilled care. If someone is in a skilled nursing facility and they start receiving intermediate care or even move into custodial care, there is no coverage for through Medicare. With Part B, your medical coverage, the out-of-pocket costs for 2024 include a yearly deductible of $240 and then typically a 20% coinsurance. And so essentially Medicare will cover 80% of the Medicare approved amount. There's a 20% coinsurance that falls to individuals enrolled in Medicare Part B. Now, there also are situations where there's extra billing by non-participating physicians, and this all depends on your FEHB plan. I do want to note here that that FEHB plans do step in and in most cases cover the cost share and out-of-pocket costs that I just described for Medicare A and B when you're enrolled in them and an FEHB fee-for-service plan. I'll talk a little bit about that last point about the extra billing by non-participating physicians and what to look for from your plan. I told you at the very beginning that one of the important things to think about is how your provider interacts with Medicare, the provider type. and this is applies to fee-for-service plans. So Medicare Part B has essentially 3 different provider types, and some of the language can be a little bit confusing, but I'm going to use the official Medicare language so it's clear and so that if you're talking to a provider, you know what to ask them. Now, there are those who are known as participating providers, which means they accept assignment from Medicare. So these participating providers agree to be paid by Medicare, and they accept the amount that Medicare approves for their services. They charge only the Medicare deductible and or the coinsurance amount. And in that case, your FEHB plan will cover the cost sharing with these Medicare participating providers. The second category are known as non-participating providers, and this means that they do not accept assignment. So what does this mean in practical terms? This means that these providers can charge more than the Medicare approved amount, but there is still a limit. It's literally called the limiting charge, which is usually about 15% more than the Medicare approved amount. FEHB plans will cover that regular cost sharing up to that 20% of the Medicare approved amount. Now, in some cases, the patient may be responsible for the extra 15%. In other cases, depending on your plan, some FEHB plans will cover the additional cost sharing up to the limiting charge. I'm going to show you an example using numbers here in just a minute to try to make this a little bit clearer. But first, I want to talk about that third type of provider, which is the one to be most aware of if you're enrolled in Part B. And these are what are known as private contract or opt-out providers. So they do not participate in Medicare at all. And they will provide you with an individual written agreement between you and the provider that is essentially an agreement not to bill Medicare. They're not going to bill Medicare. You can't bill Medicare. You can't bill, nobody's going to bill original Medicare. They can't bill other Medicare plans, including Medigap plans. And those plans, Medicare of any type, will not pay. So you are responsible for all charges. No claim, once again, can be submitted to Medicare. And it's worth noting you cannot be asked to sign one of these agreements in an emergency situation. I do want to call out the FEHB plan's responsibility, though. FEHB plans will not pay, and they cannot pay any more than they would have paid if Medicare had made payment. So generally 20% of the Medicare approved amount per federal regulation. This is when you're enrolled in Medicare A and B, and you're going to an opt-out or private contract provider. So what does this look like in terms of numbers? Let's start with providers who accept Medicare. And for all 3 of these examples, I'm going to use $1,000 as the billed amount. So you go to your provider, you receive a service, and their typical amount that they would bill is $1,000. For a Medicare provider, they're going to accept the Medicare approved amount as $800. That's all they're actually going to end up charging. They'll send the bill to Medicare. Medicare will pay their portion, 80%, or $640. That leaves a balance of $160, which will be picked up by your FEHB plan. They'll pay that other 20% of the Medicare approved amount, meaning that you have a $0 liability as a member with Medicare and your FEHB plan. In a situation where your provider does not accept Medicare, once again, they're billing $1,000 typically for this service. Because they don't accept Medicare, they can charge up to the limiting charge, essentially 115% of the Medicare approved amount, or a total of $920. Medicare will still only pay 80% of the Medicare approved amount, or $640. FEHB plans will pay their 20% of the Medicare approved amount, or $160, and your liability will be $120. Now, again, check your individual plan information, the plan brochure, to find out if your plan picks up this additional 15% up to that Medicare limiting charge. Some do, some do not, but check your plan. This example assumes that the FEHB plan does not. They're only paying the 20% of the Medicare approved amount. Finally, and this is the example why I encourage you to be careful with private contract or opt-out providers. So once again, the provider is billing $1,000. The Medicare approved amount is $800. However, Medicare cannot be billed by the provider or by you. So Medicare pays nothing. Your FEHB plan only pays their 20% of the Medicare approved amount. This is what federal regulation requires. That means you are left with an out-of-pocket cost of $840. It's very important to understand how your provider interacts with Medicare. And this may also be a factor when you're choosing whether or not to enroll in Part B. If you go to a provider, you really like them, you want to stay with them, and they are an opt-out provider, Medicare Part B may not be for you because it may actually end up increasing your out-of-pocket costs. So please keep this in mind. Have those conversations with your doctors. Make sure you understand what their role with Medicare is and how your FEHB plan covers it if they do not accept Medicare amount and charge up to that limiting coverage. Okay, if you are retired over the age of 65 and you have an FEHB fee-for-service plan and Medicare, in that situation, Medicare A, and assuming you have Medicare Part B, those will be the primary payers. Medicare pays first, your FEHB plan pays second for those Medicare covered services. Now, it's worth noting that plans fill most of the gaps in Medicare. So the Medicare deductible, the co-pays and co-insurance that we talked about for services that are covered by Medicare. Be aware, though, it's the third time we're talking about skilled nursing facilities. Be aware of skilled nursing facility limits. There are limits under Medicare, and if your FEHB plan has coverage for skilled nursing facilities, it also has limits. And it's worth noting that if your plan says they cover up to 90 days, those 90 days don't stop when Medicare coverage ends. They run concurrent with the Medicare coverage. So please just keep that in mind. Plans waive some costs like the deductible, medical co-insurance and co-pays and more. And plans coordinate coverage through coordination of benefits with Medicare. This generally means that individuals have little or no liability. Now, your FEHB plan remains primary for prescription drugs, except for a limited number and classes of drugs like injections at the doctor's office, certain oral cancer medications, and more that fall under Part B. If you have an FEHB HMO plan, a health maintenance organization, and Medicare Part B, and you're retired at over age 65, take a close look at what your benefits are because FEHB HMO enrollees may not need Medicare Part B. It just may be that you're not going to recover the cost of Part B expenses for the benefits received because of the way your HMO may be structured and the cost sharing you have there. But it's also worth noting that Part B would pay for costs involved in seeing providers outside of the HMO network. So if you are in an HMO, it's a closed network. You can only see providers in that network. And you think in the future you may want to go outside of that, then Medicare Part B would pay primary for those out-of-network providers who participate or don't participate with Medicare. Once again, not for the opt-out of private contract providers. Now, some plans in the FEHB program do offer incentives to encourage members to enroll in Medicare Part B. This includes waiving co-pays and co-insurance and even annual calendar year deductibles. It may also result in lower prescription co-pays, and some plans also offer limited reimbursement or reduction for a portion of the Medicare Part B premium. Now, this varies from plan to plan. Sometimes it's just if you're enrolled in Part B. Some plans require that you be enrolled in their federal Medicare Advantage plan that's offered under their plan. We'll talk more about those in just a moment to receive this reduction. So please check with your plan for the specific details, and the amounts vary also. Sometimes it's $50 per month that you're enrolled in Part B. Sometimes it's $66 and 66 or 67 cents. Sometimes it's even up to $100. So it does vary. Check with your plan for the specifics, and it can also change each year. I mentioned that some of the federal plans are starting to offer their own Medicare Advantage plans. Now, these are not commercial plans like I talked about earlier. These are Medicare Advantage plans offered under the umbrella of the FEHB plans. These Medicare Advantage plans do offer some value-added options, and they vary depending on the plan, but I want to share some examples here. So some offer services for meal delivery following a hospital stay. Some also have non-emergency transportation to medical appointments. through a partnership with a ride-sharing service. Some also cover telehealth, which has not traditionally been covered under Medicare. Others have fitness benefits through programs like Silver Sneakers, and sometimes this is the only way you can access programs like Silver Sneakers. I mentioned the Part B premium reductions that may be available under these Medicare Advantage plans, and then many of the Medicare Advantage plans also pair up with Part D prescription coverage. Now, this may be optional. It may be part of an integral to the Medicare Advantage plan's design. Additionally, you may find some plans that offer enhanced benefits for hearing aids, vision, and even increased dental coverage. Please note you must be enrolled in Medicare Parts A and B to select one of the Medicare Advantage plans. You won't have to suspend your FEHB plan as you would with a commercial Medicare Advantage plan, because you want to remain enrolled in your FEHB plan and just contact them to opt into the Medicare Advantage plan that they are offering. Please do understand, though, that Medicare rules apply to these Medicare Advantage plans. It's not the same as the regular FEHB plan rules. And as I noted just a moment ago, these are opt-in plans. You must choose to enroll. You contact the plan through whatever means they have established, and check the rules for being able to change back to the regular plan throughout the year. They should have that option available. That does typically, though, have to be done in writing, and the plan can let you know how to do that to move back from the Medicare Advantage plan to the regular FEHB plan. Now, new in 2024 are these Medicare prescription drug plans, PDPs, that some of the plans are offering. These the prescription drug plans allow group plans, such as your FEHB plans, to enroll members age 65 and older in a Part D prescription drug plan and take advantage of lower costs set within Medicare Part D plans. And in many cases, plans are operating this differently, and it may change throughout the year, may change going into 2025. So, like I said earlier, we will have an update next year, but many of the plans chose to go with automatic enrollment of eligible members. The criteria for who's eligible does vary for each plan, but they are doing automatic enrollment in many cases. There is an option to opt out if you desire, or to disenroll. But it's also worth looking at these plans. The cost structure for the cost sharing can make the option appealing for members with lower copays and lower out-of-pocket maximum for prescription drugs. But I do want to note again that with these PDPs, CMS rules apply, including the possible IRMA premium add-on for Part D. And this is only an enhancement to the prescription drug benefit outlined in brochures in Section 5F. Members receive the other benefits they have and the other access to the other programs within the regular plan design. This is just a prescription drug change. You can opt out, must opt out for plans that are doing auto enrollment to stay with the regular 5F benefits. And some plans will actually allow you to opt back in any time. Some may make you wait until the next open season, but I encourage you to do the math. If you were someone who is higher income, you may find that you'll be paying more in IRMA than you would ever receive in benefits, even with lower cost sharing under the Part D plan. However, if you're someone who's maybe in one of the lower income tiers and may have a lower IRMA for them each month, but you're on a number of specialty drugs, you may find that this plan can result in substantial out-of-pocket cost savings for you throughout the year. That may be the right option for you, especially if it has a lower out-of-pocket maximum, which all Part D plans are starting to lower those in a tiered way for beginning in 2023 and ending in 2025 with an out-of-pocket maximum of $2,000 for prescription drugs. So please do the math, get information from your plan, make sure you understand what it is that you might be enrolling in. Okay, I want to get toward a wrap-up now. So with Medicare and FEHB, there are some ins and outs to consider. First of all, I want to stress again that Medicare does not provide coverage for spouses and children. There's no family enrollment, no self+1. FEHB is primary on a spouse who's under age 65 and does not have Medicare. So it may be that you're the enrollee, you become Medicare eligible, decide to go that way, but your other family members will still remain enrolled with primary coverage under the FEHB. I encourage you, take a look at your FEHB plan brochure. Section 9 has details on how that plan coordinates benefits with Medicare. There's also a very useful primary payer chart that will explain who pays first and when. If you are a tandem couple, so both you and your spouse are eligible for FEHB, please note that Medicare Part B is an individual decision. It may be right for one of you and not for the other. FEHB is primary on a spouse who does not have Medicare. So, if one spouse is actively employed, remains active duty, you might consider making a change so that that spouse has primary enrollment and covers the spouse who is age 65 and retired and Medicare eligible. Because you could delay and that decision on Part B, because in that case, you, as a person who's retired and Medicare eligible, would still be covered under a plan that's the result of current employment, your spouse's plan when they're still currently employed. You then, once you stop receiving coverage under that active employee plan, would qualify for a special enrollment period. It might be, though, take a look, the premium might be higher for a family or self-plus-one enrollment than for two self-only plans. But when you factor in the potential premiums for Part B, you may find that that family or self-plus-one enrollment makes sense. So this is an individual decision, and it will vary from one family to the next, what makes the most sense. We do get some people who have TRICARE and are eligible for TRICARE for life. So I want to note here that Medicare and A and Medicare B enrollment in both of those programs is required in order to maintain TRICARE eligibility and use TRICARE for life. If you use TRICARE for life and continue your FEHB, TRICARE is normally the last payer. Typically, Medicare pays first, your FEHB plan pays second, and then TRICARE comes in at the end. But also note that you can suspend your FEHB coverage and use Medicare and TRICARE for life without losing the right to return to your FEHB coverage during a future open season. But before you suspend your FEHB coverage, consider the following. Do you spend most of your time overseas? And do you use a specific benefit that is covered by your FEHB plan, but perhaps not covered by Medicare and TRICARE? Just some things to think about there. This slide has a number of resources on TRICARE, including going to tricare.mil/TFL for TRICARE for life. A number of other resources that have been provided by experts, including some links to publications that you can see there, as well as OPM's website. So I encourage you to check those out and consider your options. Now, I promised that we would also talk about what happens if you don't enroll in Medicare Part B. Good news is you have the same benefits that you've had before you became eligible for Medicare. And you've got some additional protection because of the law that's cited there on the slide. Your little liability is limited. This basically says that by law, fee-for-service plans must limit their payment for inpatient hospital care and physician care to those payments you would be entitled to if you had Medicare. Your physician, Medicare participating and not participating, this does not apply to those opt-out private contract providers, and hospitals cannot bill you more than they could bill you if you had Medicare. So you've still got some protections there. You, though, remain responsible for deductibles, co-insurance, or co-payments under the FEHB program plan. And as I hinted at before, if you're seeing an opt-out physician for outpatient care and non-physician-based care, they are not covered by this law. However, if you're using a network provider, discounts through that network agreement still apply, so you still have protection. You also would possibly have more coverage than you would if you had Part B and FEHB, depending on your provider's network status or your plan's coverage for in-network and out-of-network providers. So please keep that in mind. Again, consider your doctors and their status with Medicare before making your decision. So again, we started out with a question. We're going to end up with the same question. Medicare Part B, should I or shouldn't I? Consider a number of factors. First, again, where we started, will you spend a great deal of time outside the United States? If the answer to that question is yes, Medicare Part B may not be the right decision for you. Also think about your financial situation, both now and as retirement progresses. While you might not be concerned about that means adjusted gross income, consider the cost of healthcare. It may be that your income does put you in a higher category, so you're thinking, all right, Medicare Part B is not for me, But the cost of healthcare is not going down. And typically, as we age, our health is not getting better. We're seeing doctors more often. We are seeing specialists. We may require procedures that may have additional costs and may increase our out-of-pocket costs. With Medicare Part B in your FEHB plan, you are virtually 100% covered. And also keep in mind, if you like some of the benefits under those Medicare Advantage plans, either in the commercial sector or within the federal program, you have to be enrolled in Part B to enroll in a Medicare Advantage plan. And you could face that penalty if you wait to enroll in a Medicare Part B later to take advantage of a Medicare Advantage plan. Also, mentioned this before, how is your health? Again, it doesn't typically get better as we get older. Think about your family members, maybe your parents or siblings, what their health was like as they're aging. And then also think about the status of your doctors. I can't stress that enough, particularly if you're seeing an opt-out provider, what their status is. Consider that in making a decision about Medicare. And think about your tolerance for paperwork. There is what's known as electronic crossover from Medicare Part B to FEHB plans. So basically, Medicare Part B gets the claim, they pay their portion, and they send it electronically to your FEHB plan without you having to file the claim twice. So there's virtually no paperwork for you to receive your maximum benefits under the two programs. This slide lists a number of additional resources that are available from OPM, from Social Security Administration, Medicare, and just as an example, AFSPA offers a dedicated page for our plan, Foreign Service Benefit Plan, and Medicare. And I'm showing the cover of a brochure that we have about our plan specifically and how it works with Medicare. Many plans produce a similar brochure, so contact your plan, check their website to get their specific brochure. I also want to note that this recording is part of a series, and we have a number of podcasts and videos out there about Medicare, including this one, Medicare and the FEHB. We also have a previous recording where we had a guest, Dr. Christine Hunter, who is a retired Navy admiral who ran part of TRICARE and then went on to become the chief medical officer for the Office of Personnel Management. She talked about Medicare, TRICARE, and the FEHB. We've also done programs on Medicare Advantage plans, as well as a specific one about the Medicare Express, the FSBP Express Scripts Medicare Prescription Drug Plan as one example of one of these new PDPs. So I encourage you, visit AFSPA.org/podcasts for more of these, or visit our YouTube page at youtube.com/AFSPAcares to watch the videos, which you may find more informative, especially if they include some slides like this one. And if you have questions, I welcome them. A colleague with expertise in Medicare or I will get back to you to try to answer your questions as promptly as possible. You can see my contact information there. Our main number is 202-833-4910. My email address is my name, kyle.longton@afspa.org. I hope that you found this presentation, this overview of Medicare and the FEHB to be useful. I encourage you to check out the other recordings we offer both through our podcast series and through our video series on YouTube, and check out our website at afspa.org for more information about the programs and services we offer. Thank you.